Did you know that millions of people around the world silently struggle with urinary dysfunction? This common issue can significantly impact one's quality of life. It affects men and women of all ages. Urinary dysfunction can make everyday activities challenging. It can also lead to embarrassment and social isolation. Urinary dysfunction encompasses a range of issues. These include incontinence, urgency, and retention. Incontinence involves the involuntary leakage of urine. This can happen during exercise, sneezing, or even laughing. Urgency is characterized by a sudden and overwhelming need to urinate. Retention, on the other hand, refers to the difficulty or inability to empty the bladder completely. The impact of these issues extends far beyond physical discomfort. They can disrupt sleep, work productivity, and social activities. Imagine having to constantly worry about finding a toilet or experiencing embarrassing accidents. The emotional toll can be significant, leading to anxiety, depression, and a diminished sense of well-being. It's crucial to remember that urinary dysfunction is not a normal part of aging. While it becomes more common with age, it is not inevitable. There are effective solutions and innovative approaches that can help individuals regain control of their bladder health and improve their overall quality of life. Urinary dysfunction can stem from various factors. These include lifestyle choices, medical conditions, and psychological aspects. Understanding these causes is crucial for effective management and treatment. Lifestyle factors play a significant role in urinary health. Excessive consumption of caffeine and alcohol can irritate the bladder and worsen symptoms. Similarly, both dehydration and overhydration can disrupt normal bladder function. Obesity can put pressure on the bladder, leading to incontinence. Constipation, often overlooked, can also press against the bladder and affect its ability to hold urine properly. Medical conditions can also contribute to urinary dysfunction. Urinary tract infections, or UTIs, can cause inflammation and irritation, leading to frequent urination and pain. Neurological conditions like multiple sclerosis, Parkinson's disease, and stroke can disrupt the nerve signals that control bladder function. Diabetes can damage nerves and blood vessels, affecting bladder control. In men, an enlarged prostate can obstruct urine flow, leading to retention and other complications. In women, pelvic organ prolapse, a weakening of the pelvic floor muscles, can cause the bladder to drop and press against the vagina, leading to incontinence. Psychological factors can exacerbate urinary symptoms. Stress and anxiety can trigger a frequent urge to urinate, even when the bladder is not full. Depression can affect motivation and make it challenging to adhere to treatment plans. It's essential to address both the physical and emotional aspects of urinary dysfunction for comprehensive management. Fortunately, there is a beacon of hope for those struggling with urinary dysfunction. Innovative approaches and effective treatments are available to help individuals regain control of their bladder health and improve their quality of life. One such breakthrough is posterior tibial nerve stimulation, or PTNS. This minimally invasive procedure involves applying gentle electrical stimulation to the tibial nerve, which runs along the leg. PTNS helps modulate bladder activity and reduce symptoms of overactive bladder and urge incontinence. It offers a safe and effective alternative to medications for many individuals. Another promising development is Emsella, a non-invasive treatment that utilizes electromagnetic energy to strengthen pelvic floor muscles. This painless and comfortable procedure involves sitting on a chair-like device that emits electromagnetic pulses. These pulses induce thousands of supramaximal pelvic floor muscle contractions, effectively retraining and strengthening the muscles that support bladder control. In addition to these cutting-edge treatments, lifestyle modifications play a crucial role in managing urinary dysfunction. Adjusting fluid intake to ensure adequate hydration without overdoing it can help regulate bladder habits. Avoiding bladder irritants like caffeine, alcohol, and acidic foods can reduce irritation and urgency. Managing constipation through dietary changes and fiber intake can alleviate pressure on the bladder and improve its function. Urinary dysfunction, while common, is not an insurmountable challenge. With the right approach, individuals can manage their symptoms effectively and live full and active lives. It's crucial to remember that seeking professional help is the first step towards reclaiming your urinary health. Healthcare providers can offer personalized guidance and recommend the most appropriate treatment options based on your specific needs and underlying causes. They can also provide valuable education on lifestyle modifications, pelvic floor exercises, and bladder training techniques that can significantly improve bladder control. Remember, you are not alone in this journey. Millions of people around the world face similar challenges. By sharing your experiences, seeking support, and staying informed about the latest advancements in urinary health, you can take control of your condition and live a brighter, more fulfilling life. Don't let urinary dysfunction dictate your future. Take charge of your health and embrace the possibilities for a healthier, happier you.